Hospitals in southern Illinois are facing a critical shortage of available ICU beds. The highly contagious Delta variant of COVID-19 and low vaccination rates have combined to create a perfect storm that's overwhelmed hospitals and staff for the last month. And for at least 4 days last week, there were literally no ICU beds available in the southernmost portion of the state. Today, there are just 2, and the situation changes by the hour. Joining us now to help us understand the present crisis are Aaron Herman, who manages the Regional Hospital Coordinating Center for the 23 counties in the Illinois Department of Public Health's Region 5 in the southernmost part of the state, and Dr. Vineet Arora, one of the founders of the Illinois Medical Professionals Action Collaborative Team, or IMPACT, which works to promote science-based facts and education in relation to the COVID-19 pandemic. She's also the Dean of Medical Education at the University of Chicago Pritzker School of Medicine. Welcome to both of you, and thank you for joining us. Aaron, let's start with you, please. Can you give us a sense of the current situation in Region 5? How dire is it?
Well, it's definitely improved over the past few days as we've been getting more surge staff thanks to our partners over at the Illinois Department of Public Health and the Illinois Emergency Management Agency. But you are correct that we have had few, if any, ICU beds over the past week. Today, we're only showing 2.
And for example, if you should have someone who needs to be brought into the ICU, but those 2 beds fill up, if things can happen quickly, what happens if there is no bed available? What are your options?
Well, one of a few things will happen. Depending on the acuity level of the facility, one option is to move additional equipment and resources into a med-surg bed. Otherwise, that patient is going to have to be transferred to a available ICU bed, which may mean going as far away as Indianapolis or Nashville.
And that can also mean a backup in ambulances as well, right? Just because it takes longer to turn that ambulance around after making such a long trip.
We are a rural area. Most of our counties have, if they're lucky, 2 ambulances on duty at any given time. So if an ambulance that normally would have traveled from a critical access hospital 35, 40 minutes away turned around and come back, and now they have to travel 3, 4, maybe 5 hours one way, drop their patients, sanitize the rig, drive 5 hours home, that's leaving that county without that resource for a very, very long time.
A risky situation, it sounds like. Dr. Arora, how would you describe the morale of frontline workers right now, medical professionals in particular, who've been fighting this for so long?
Thank you for having me, and I would simply say that it's devastating. Frontline healthcare workers have been fighting this for 18 months, and unlike the other surges, and I should say, my colleagues have always risen to the occasion, and everybody in medicine and healthcare views this profession as a calling and is, of course, ready to fight. The challenge right now is that we are tired. And unlike the prior surges where there wasn't, this is preventable. This surge is preventable. We have a way to prevent hospitalizations, and that is the COVID-19 vaccine. And unfortunately, because of that low uptake, this surge is occurring, and that is really harming healthcare workers' psyche on the front lines right now, because we know we got vaccinated, and we know that if more people got vaccinated, that this would not be happening.
To that end, how much of these low vaccination rates, Dr. Arora, how much of that is about misinformation and disinformation?
Yeah, thank you for that question. I would say initially, when the COVID-19 vaccine first came out and healthcare workers were first in line and followed by seniors, we did see some hesitancy around, obviously the vaccine is new. It is no longer new. We have a lot of data, a lot of studies. And right now, I think what we are doing is battling against misinformation and disinformation that is just perpetuating. There are myths that are being spread about the COVID-19 vaccine. And I should also say, unfortunately, it has also become politicized. closed. And that is very unfortunate. And it has left regions of the country, particularly regions like Southern Illinois and other rural regions, incredibly susceptible because they already face a devastating shortage of healthcare workers in those regions, as well as potentially lower bed situation.
Erin Herman, you mentioned that you're starting to get some more staff that are coming into the region from other regions, and you're getting resources from IDPH, but is what you're getting enough?
Well, it's very slow in coming is the problem. Last week, we had 84 staffed ICU beds in the region. That number has now risen to 90. Of course, as fast as we create these new bed spaces, we're filling them up because of the backlog of patients that we had being boarded in our emergency departments. So the state is doing their very best to send us these additional resources, but they're competing with 49 other states for all of these surge staff that are coming from agencies for the most part.
Okay. Dr. Aurora, what would you say it's going to take to turn this situation around?
Well, immediately, we really need people to start trusting in the vaccine and trusting healthcare providers, their local physicians and nurses. Although we have an epidemic of distrust, healthcare professions are still some of the most trusted professions in the United States, and particularly people trust their own healthcare provider, their own doctor. And we need people to have those conversations and really take the advice of their medical providers to get vaccinated. Getting vaccinated will not turn around the ICU bed crisis right away. It will help in a few weeks. What will help right away is really stopping the spread through wearing masks. And that is a simple way that can easily stop the spread. And unfortunately, both of these things have been politicized and subject to misinformation. But that's really, really what it's going to take, because even after the surge ends, we're going to be in a situation where there's going to be a lot of delayed care, catching up to all the healthcare that was put off.
And Dr. Aurora, thanks for the work that you do. Same to you, Erin Herman, and thanks to you both for joining us.
Thank you.
Thank you for having us.